So what do you think of when you think of celebrities like Lindsay Lohan, Charlie Sheen, Britney Spears, especially Charlie Sheen? You'll probably think of drug abuse or addiction. But what about everybody else? There's children, teens, and adults that can become addicted and are addicted to drugs all around the world. Addiction is like a cycle, almost like poverty. Once you're born into addiction, you can't really escape. If your parents are addicted, it's most likely that you're going to become addicted too. Now, I started thinking about this topic when I started reading the book Lullabies for Little Criminals. It's about a 13-year-old girl. Her name is Baby, and she lives with her father, who is addicted to heroin. Now, Baby gets a rough upbringing. She's alone with her father, and they move around a lot. She lives in a sketchy town, and she ends up becoming addicted to heroin herself, and she's only 13 years old. And reading this book reminded me of a book I read a while ago that I decided to reread called Crank. Now, Crank is roughly the same but different. We have a girl, her name is Christina, and she lives with her mother, who is relatively wealthy, and they live in a nice neighborhood. But Christina decides to go visit her father because she hasn't seen him in a few years. And her father lives in a kind of a rough neighborhood, and he's addicted to crank, which is also methamphetamine. Now, once she comes back to her mother after 3 weeks of visiting her father, she is addicted to crank herself, and her whole life changes mostly for the worse. Now, what is addiction? Addiction, as society defines it, is a moral failing or a lack of willpower, someone who's controlled by their addiction. But the actual definition here is a chronic, often relapsing brain disease that is characterized by drug seeking and use despite harmful consequences. So the difference here, society has kind of a misled perception of what drug abuse actually is. Now, how you become addicted to drugs is a mix of nature and nurture. So you have your biology and your genes, which is nature. So if you've grown up with a parent or if you're born from a parent who's had an addiction, you may inherit their ability to metabolize drugs or their ability to tolerate certain drugs, and then your environment that you grow up in. If you're in a chaotic home and there's abuse or there's drug abuse from your parents or there's your peers that influence you, you may also get addicted to drugs. So the drug of choice and your brain mechanisms equals whether you're going to get addicted or not. And we have all these people here, and there's not really a difference. We have some people going through therapy, we have some people being treated for physical disabilities, and then we have someone at a supervised injection site, which is one of our biggest step forwards in the treatment of addiction. So it prevents people from getting different diseases from like dirty needles if they're using it to inject drugs. So there's really no difference between these people. They all have either a physical or a mental problem that's being dealt with by a medical professional. Now, some of the medical symptoms of a person under addiction is the same as someone who's being treated for a mental or physical disorder. So we have maybe depression, anxiety, they could possibly overdose, we have eating disorders, memory loss, mental disorders, you can have an unplanned pregnancy, suicidal thoughts, and post-traumatic stress disorder is also a symptom as well, which can be caused by an extreme trauma to the system. And on the left here, we also have an image showing a healthy brain and a healthy heart, and then a diseased brain and a diseased heart. And the diseased brain is someone who's abused cocaine. Now, there's an obvious difference here between the healthy brain and the diseased cocaine brain, and there's a lot less activity going on in the brain. And if you compare it to the heart disease patient, we have the healthy heart and the person with heart disease, and their heart is also a lot less active. So comparing a drug abuser to a heart disease patient is actually not so different. Now, if we go to the educational standpoint, we have two ways that a child can deal with addiction in the home, or this is their way to cope. So they have either poor academics or exceptional academics. They can be less socially active, or they can be more socially active. Or they can drop out, be suspended, be expelled, or develop learning disorders. It's all a matter of how this child chooses to cope with what's going on at home, or their drug addiction. Now, to go into the brain and how it's stimulated by drugs, we have an example of people communicating. We have the transmitter and we have the receptor. The brains work relatively the same. We have the neurotransmitter and the receptor, and the transporter sends out the neurotransmitter. So when your brain is on drugs, we have this as the example of the reward or pleasure pathway. We have the transmitter that sends out dopamine, which is the neurotransmitter for the pleasure pathway. And this dopamine goes from the transporter to the receptor and back, and that's what triggers the pleasure. And then we have the drug abuse. We have someone who's doing cocaine, and the transporter sends out all this dopamine, but the cocaine blocks the transporter from receiving the dopamine afterwards. So you end up with a bunch of dopamine just stuck in the middle of the receptor and the transporter, which causes the communication to be altered. It causes confusion and disorientation, as well as a huge increase in pleasure or reward. And then for lullabies, we have a heroin user. So the effects of heroin on a controlled brain, this is the pleasure pathway, and this is the dopamine receptors that are being active here. And on the bottom we have the control, which is a normal brain, and then we have another brain who has had heroin. And obviously there's a difference there. There's a lot less activity. Even compared to alcohol, methamphetamine, and cocaine, there is significantly less activity. And going to methamphetamine, we have on the right, we have a healthy controlled brain, and we have a drug-addicted brain. And there is a huge, significant impact of the amount of activity. And then on the left, we have a healthy person, and we have a meth abuser with 1 month abstinence. Now, it still has a significant difference, even after they haven't taken methamphetamine for over a month. Now, 14 months later, you see the activity starting to come back. And this is why we need to treat this like a disease, because we can treat it. We can get that brain function back working normally if we just attempt to treat it like a disease rather than a moral failing. So we as a society, we need to treat it as a disease in order to create a better future for our children, the children of addicts or the children of parental abuse. And the cycle of poverty and addiction can be stopped with this. If we treat it like a disease, we can stop the cycle of poverty, the cycle of addiction, and we can create a better future for our children of addicts. Thank you.